Well, in this month's Heart Talk, we focus on the connection between your heart and depression. We're fortunate to have our daytime cardiologist with us, Dr. Shobha. Always good to have you on the show. Great information, great topics, things to get our wheels turning, you know?
Yes.
And today talking about sort of that correlation when it comes to depression in our heart. We know a lot of things can affect our heart's well-being.
Right. And depression is a big factor that affects our heart. And people with heart disease are at high risk for having depression. And, people have certain behaviors when they're depressed that can aggravate heart disease. But also there may be bad, sad hormones that can actually affect the heart as well. And it is well known that people who have a heart attack or have heart failure or have heart disease have a much higher chance of becoming depressed. In fact, 1 in 5, 20%. And the sad part is people who are depressed and have heart disease have a higher risk of dying as well.
So and they can really go both ways.
Yes, it's a direct connection both ways. One aggravates the other. And like you said earlier, depression is underdiagnosed. Mm-hmm. People don't know they have depression. If we go over symptoms of depression, for example, all of us have good days. We have the winter blues like you were talking about earlier. All of us have good days and bad days. We feel down. But you're feeling down for a long time, over 2 weeks. You're fatigued all the time. Your sleeping habits are changing. You're not able to sleep well. You're gaining weight. Or the elderly some people may actually lose weight. And the other extreme, people may want to harm themselves, suicidal behavior. Mm-hmm. That's the extreme. But it's the mild to moderate parts that are totally unrecognized. And those people actually indulge in behaviors that are not heart healthy. For example, they may not seek help when they need to if they're having symptoms. Mm-hmm. And they may not eat right. Their blood pressures may not be controlled. They may not take their medications correctly. And people around them, don't recognize that they're depressed. They may not recognize they're depressed. If you have a cough or cold, you're sneezing, hacking, you have a fever, oh yeah, you need to go to the doctor. Your wife, your children, your parents, whoever, they'll say, go to the doctor. But when you're depressed, nobody may recognize it. And we as a community need to identify, help identify it in our loved ones. And sort of help that process. And depression needs to be treated. There are behavioral therapies, there are physical activity therapies. People who are depressed tend to isolate themselves. They don't indulge in, embracing others, feel good kind of moments. And we need to help them do that. There are medications for depression as well. So,
and you said really as a community, this is a perfect time with spring here to really come together and provide those resources that are available within our community to help them get the help they need. Dr. Shobha, always good to have you on the show. Thank you so much for joining us. For more information on depression and other things that can affect heart disease, so important, you can check out the website heart.org. We're back with more of Daytime right after this.